Why life expectancy of doctors is 10 years less than national average. We, being the doctors who are able to successfully increase the lifespan of entire society from 35 years during independence, today the life expectancy of every citizen is 70 years. But sometimes I feel why we are not taking care about our health. This is the real biggest challenge every doctors and healthcare worker facing. I am very curious to hear from the insight from our respected speaker, Dr. Pavana S., moderator, Dr. Professor Dr. Pawan Kumar M. I am sure today's session will guide all of us towards achieving healthier balance between professional as well as personal well-being. I thank each and everyone for joining. So let us start this program with the IMA prayer. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಪ್ರಾರ್ಥನೆ. ಎಲ್ಲರೂ ಸಂತೋಷವಾಗಿರಲಿ, ಎಲ್ಲರೂ ಆರೋಗ್ಯವಾಗಿರಲಿ, ಎಲ್ಲರೂ ನೋವಿನಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲರೂ ದುಃಖದಿಂದ ಮುಕ್ತವಾಗಿರಲಿ, ಎಲ್ಲ ಆಸೆ ಆಮಿಷಗಳನ್ನು ಮೀರಿ ಗುಣಪಡಿಸುವವರು ನಾವಾಗಿರಲಿ. ಧ್ವಜವಂದನೆ. ಭಾರತೀಯ ವೈದ್ಯಕೀಯ ಸಂಘದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜಕ್ಕೆ ವಂದನೆ ಸಲ್ಲಿಸಲು ಇಲ್ಲಿ ನಿಂತಿದ್ದೇವೆ. ಅದರ ಗೌರವ ಮತ್ತು ವೈಭವವೇ ನಮ್ಮ ಬೆಳಕು ಮತ್ತು ಶಕ್ತಿ ಮತ್ತು ಅದರ ಪಥವೇ ನಮ್ಮ ಪಥವು. ಈ ರಾಷ್ಟ್ರೀಯ ಸಂಸ್ಥೆ ಮಾನ್ಯತೆ ಪಡೆದ ಸದಸ್ಯರಾದ ನಾವು ನಮ್ಮ ಜವಾಬ್ದಾರಿಗಳನ್ನು ಅರಿಯುವ ಮೂಲಕ ಅದಕ್ಕೆ ನಮ್ಮ ನಿಷ್ಠೆಯನ್ನು ತೋರಿಸುವ ಪ್ರತಿಜ್ಞೆ ಮಾಡುತ್ತಿದ್ದೇವೆ. ದೇಶ ಸಮೂಹಗಳ ನಡುವೆ ನಮ್ಮ ರಾಷ್ಟ್ರಧ್ವಜವು ಉನ್ನತ ಮಟ್ಟದಲ್ಲಿ ಹಾರಾಡುವ ಸಲುವಾಗಿ ನಮ್ಮ ಅಧಿಕಾರದಲ್ಲಿರುವ ಎಲ್ಲವನ್ನೂ ಅದಕ್ಕೆ ಸಮರ್ಪಿಸುವ ಪ್ರಮಾಣ ಮಾಡುತ್ತಿದ್ದೇವೆ. ಜೈ ಹಿಂದ್. IMA ಚಿರಾಯುವಾಗಿರಲಿ. ವಂದನೆಗಳು.
ಸರ್ ಮ್ಯೂಟ್ ಆಗಿದ್ದೀರಾ?
Rajendra Prasad sir. I request our Dr. Pawan Kumar to welcome the gathering. Sir, you are muted.
Good evening, everyone. I would like to welcome everybody for today's wonderful evening Zoom meeting. First of all, I would like to welcome our KSB State President, Dr. Veerabhadraya sir. Welcome, sir.
Thank you, sir.
I would like to welcome our KSB State the Secretary, Dr. Suri Raju sir. Welcome, sir. And I would also like to welcome Dr. Harish sir for today's Zoom meeting. Welcome, sir. I would like to welcome our senior, most enthusiastic Dr. Rajendra Prasad sir and Dr. Vinay Prasad madam, and today's wonderful speaker, beautiful topic which will be discussed now, Dr. Pavana madam. And I would like to welcome all other seniors from IMA KSB and other office bearers and all the audience for today's Zoom meeting. I would like to start with, because this is a much needed topic for all the doctors, because it is very difficult for us to handle stress, especially differentiating professional and personal life. It will be very difficult. See, stress doesn't come after joining MBBS. I think once we start studying from the school stage itself, the stress starts for us. Like you have to become a doctor. This stress starts there. And getting a seat in MBBS, that itself is a big stress. And after getting seat, like studies and other things, most of our half life of all the doctors will go off by the time we finish PG. So then after that, starting practice and continuing with that, with the day-to-day problems what we face during work and while seeing patients, it is a big, huge Herculean task. I think this will be addressed by today's speaker. But I think one note I have to add, people who have become IMA members, I think their life expectancy has increased because most of the stress will be reduced after joining IMA. That we have faced because in Yelahanka we have seen wherever there is crisis, IMA is there. Half of our stress will be relieved after joining IMA. I think even other members also agree with this. Even in other parts, we have seen all doctors are feeling free because the life expectancy of doctors is 63 years, but national life expectancy is 73 years. But after joining IMA, it will be 68 years. That I think we can guarantee. Oh, and I would like to tell our president to just inaugurate our today's Zoom meeting. Over to ವೀರಭದ್ರಯ್ಯ ಸರ್.
ಎಲ್ರಿಗೂ ನಮಸ್ಕಾರ ಸರ್. ತಾವು ಇತ್ತೀಚೆಗೆ ದಿನಪತ್ರಿಕೆಗಳಲ್ಲಿ ಓದಿರ್ಬೋದು, ದೀಪಿಕಾ ಪಡುಕೋಣೆ ಅವರು ಒಂದು ಸ್ಟೇಟ್ಮೆಂಟ್ ಕೊಟ್ಟಿದ್ದಾರೆ. ಭಾರತ ದೇಶದಲ್ಲಿ ಮಾನಸಿಕ ರೋಗ ತಜ್ಞರ ಸಂಖ್ಯೆ ತುಂಬಾ ಕಡಿಮೆ ಇದೆ, ಮಾನಸಿಕ ರೋಗದಿಂದ ಬಳಲ್ತಾ ಇರೋ ರೋಗಿಗಳ ಸಂಖ್ಯೆ ತುಂಬಾ ಜಾಸ್ತಿ ಇದೆ ಅಂತ. ಆ ನಿಟ್ಟಿನಲ್ಲಿ ಈ ದಿವಸ ತಾವು ಇಟ್ಕೊಂಡಿರೋ ಒಂದು ವೆಬಿನಾರ್ ತುಂಬಾ ಚೆನ್ನಾಗಿದೆ. ಟಾಪಿಕ್ ವೈ ಪೀಪಲ್ ಡೈಯಿಂಗ್ ಯಂಗ್ ಅಂತ. ನಿಜವಾಗ್ಲೂ ಅದು ಸತ್ಯ ಸಹ. ಅದ್ರ ಬಗ್ಗೆ ಡಾಕ್ಟರ್ ಪವನ್ ಅವರು ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾತಾಡ್ತಾರೆ ಅಂತ ನಾನು ಭಾವಿಸಿದ್ದೇನೆ. ಸೊ ಲೆಟರ್ ಥ್ರೋ ಲೈಟ್ ಆನ್ ದಿಸ್ ಟಾಪಿಕ್. ಅಂಡ್ ನಮಗೂ ಸಹ ಸೈಕ್ಯಾಟ್ರಿಸ್ಟ್ ಕನ್ಸಲ್ಟೇಷನ್ ಬೇಕಾಗುತ್ತೆ ಅಂತ ನಂಗೆ ಅನಿಸ್ತಾ ಇದೆ. ಯಾಕೆಂದ್ರೆ ವಿ ಆರ್ ಮೋರ್ ಸ್ಟ್ರೆಸ್ಡ್ ದ್ಯಾನ್ ಜನರಲ್ ಪಬ್ಲಿಕ್. ಯಾಕೆಂದ್ರೆ ಲೈಫ್ ಎಕ್ಸ್ಪೆಕ್ಟೆನ್ಸಿ ಆಫ್ ಡಾಕ್ಟರ್ಸ್ ಈಸ್ ರಿಡ್ಯೂಸ್ಡ್ ಕಂಪೇರ್ಡ್ ಟು ಜನರಲ್ ಪಬ್ಲಿಕ್. ಸೊ ಆ ನಿಟ್ಟಿನಲ್ಲಿ ನಾವು ಯಾವ ರೀತಿ ಲಾಂಗಿವಿಟಿನ ಇಂಪ್ರೂವ್ ಮಾಡ್ಕೋಬಹುದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಲೆಟ್ ಥ್ರೋ ಲೈಟ್. ಅಂಡ್ ಐ ವೆಲ್ಕಮ್ ಡಾಕ್ಟರ್ ಪವನ್ ಫಾರ್ ದಿಸ್ ಸೆಷನ್. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಫಾರ್ ಗಿವಿಂಗ್ ಮಿ ದಿಸ್ ಆಪರ್ಚುನಿಟಿ, ಡಾಕ್ಟರ್ ಪವನ್.
Thank you, sir. I request Dr. Vinaya Srinivas to introduce the guest speaker.
Respected KSB President, sir, Secretary, sir, Harish, sir, Dr. Pawan, sir, and Speaker. I feel really proud and honored to introduce Dr. Pavana, a well-known psychiatrist. To give a brief introduction of her, she has completed her MBBS from prestigious Dr. B.R. Ambedkar Medical College, a diploma in psychiatric medicine from MVJ Medical College. She has completed her MD in psychiatric medicine from Texila University. Presently, she is working at Akshaya Medical Center, Vidyaranyapura, and also HCG Cancer Hospital, Bangalore. She has completed her fellowship in sexual medicine from JSS Mysore. She is also a fellow of European Committee of Sexual Medicine, Budapest. She is a member of International Association of Sexual Medicine Practitioners. She has participated as a resource person in many of the training programs, to name a few: Oncosexology Training Program, Sub-Sahara, that is Kenya Child and Adolescent Therapy. Then she has also participated in the training programs like Gatekeepers Training Program, that is Suicide Prevention Program. Then in many trainings programs conducted by Akshaya Medical Center. We are really honored to have you on this forum as a speaker, madam. This is really a need of the hour. All of us are very keen to know about this because every day in the WhatsApp, every month or every day we'll be seeing young doctors dying at an early age. We are all very interested to know. We all want to take some tips from you, like how to balance profession and personal life. Welcome you, ma'am. Over to you.
Thank you, ma'am. Thank you for the introduction. So I really sincerely thank Indian Medical Association Public Forum Committee for giving me this an opportunity to speak on this very, very important topic on why doctors die young. And I'm grateful to Dr. Veerabhadraya sir and Dr. Suriraju sir and Dr. Pavan Kumar and also Dr. Rajendra Prasad for having trust in me and supporting me on this. So shall I begin my presentation, ma'am? I'll share the screen.
Yes, ma'am. Yes, you can.
Yeah, I think my screen is visible.
Visible.
Yeah. Okay. So to start with, good evening, everyone. And we are here discussing on this topic. Why this is very important is, as a doctors, we are all trained to recognize disease, kind of treat it, and we are very good at what we do. We are very professional in it. But it is very, very unfortunate when it comes our own health, especially managing stress and kind of dealing with the mental health issues, we often ignore it and also miss out a lot of warning signs until and unless it is too much severe on it. So this presentation is all about to understand what a chronic stress or a burnout or a emotional exhaustion can, or dealing with a constant professional pressure can lead to doctors with, both physical as well as psychologically, how it is going to impact. Because the one truth we need to understand is, though the medicine is saving lives, but many times it slowly costs our own. So this is what we will start with. The outline of my presentation will be, one second. Yeah. So the outline of my presentation will be on what would be the statistics regarding the doctor's life expectancy, why burnout is increasing, what does the global and Indian statistics have to say, and also mental health concerns among the doctors. Why doctors hesitate taking help, and why, what is that neurobiological biology of a chronic stress causes to us? Are there suicidal risk among the health professional? Is it very different from the general population? And practically, how do we deal it on a personal front and as well as an individual and as well as an institutional wise? So to begin with, I would say life expectancy kind of basically average number of years a person is expected to live. It is both based on health and demographic factors. Why this is demographic factors is we have seen the global and as well as the Indian data, it differs a lot. Countries like Japan have a high life expectancy, whereas in 84 years, or even the as good as even when I was going through these articles, I got to know so many things about why these things are very different from our Indian population. So to say the national data, actually in India, it is an average of around 67 years. Now, the disturbing question is, where do we as a doctor stand? Even though we are having a medical knowledge, access to healthcare is, for us, it is much more easier. We know we can find it out. They haven't significantly reduced the lifespan. This is what the most disturbing thing is. And that will tell us why only having a knowledge enough is not good enough. Maintaining a lifestyle, handling your chronic stress, sleep deprivation, all those things actually matters enormously. So like having an Indian doctor's lifespan, or in what we call as an VIP syndrome. So in lot of research articles, it has been mentioned that we usually when we comparatively the studies of an Indian doctors of lifespan average to around 55 to 59 years or somewhere around it. The major cause include cardiovascular diseases and cancer. The most important contributor for this is having a VIP syndrome. That is, what do I mean by this is doctors spends most of their time sitting in the OPDs. It's a desk job, doing paperwork, attending emergency. It is always you have to be on the toes, skipping meals, not having food at time, postponing your own exercises or delaying your own health checkup. So we advise others to have a healthy lifestyle, lifestyle modifications to our own patients in a daily basis. But many of us struggle to practice it on ourselves. And over time, what has this contributed is doctors are seen with this kind of a hypertension or a diabetes or a metabolic stress or obesity. Now, this is where the major contributor for the stress, or what is that which can impact, gives us a picture on. if we say, is there any difference in the medical specialties and the life expectancy? Not all specialty can experience the same stress burden. We know it all. People who are in emergency medicine physicians tend to have a significantly shorter lifespan. This could be because of kind of unpredictable hours in their work front, constant emergencies, high emotional stress. Whereas working who are in a rural setup of a primary care physician generally show a larger longevity. And this what reminds us that how intensity environmental influence affects the health over time. And the body may tolerate stress temporarily, but not continuously for decades together. Now, are there any factors which contribute to the stress or a burden or a burnout is? The kind of burnout is now becoming almost kind of normalized in a medicine profession. See, because we have all seen, Dr. Pawan Kumar also was mentioning that the stress does not start the time we enter into the medicine. It already has started by the time you start preparing for your medical exams. So exactly the same way. See, now you can understand globally the picture is very different than when we compare to an Indian population. Globally, physician burnout are high enough. But in India, the studies has reported almost about close to 60% of them face a burnout. That means more than half of the doctors are functioning under chronic emotional exhaustion. And this burnout is not just a feeling of some amount of a tired or a fatigue. It also includes like having an emotional numbness. Most of the time, it could be a kind of a depersonalization, what we would want to say, or being irritable, reduced motivation to kind of day-to-day functioning, loss of meaning in work. It becomes very monotonous. See, all these things is what we call as a burnout. Is there anything which contributes to our work-life imbalance? So all these things of a burnout or a stress will definitely have one more adding on factor to our stress on. Why? Because many doctors work almost for about 60 to 80 hours per week. High patient load until and unless they complete their OPD, they can't return back to their homes. Eventually, this starts affecting their mental health as well. Because Indian studies have shown already prone that depression, it could be an anxiety or a suicidal ideation among the doctors are higher than comparatively to the general population, which is one of the major problems that cause doctors often to, kind of even they delay their help-seeking behavior also. See, when we know that there is something which is going on, we know that there is a stress which is undergoing, or there is a lot of burnout which we are experiencing, or as a medical health professional, there is something which is not okay going on. But why is this? Why is that there is an help-seeking behavior in doctors is not, they are not okay to consult, take a mental health consult or to professional help? It is because the moment we get into the medicine or a medical school, we are being tuned into becoming unintentionally, it teaches us to tolerate suffering very silently. We kind of start normalizing it. We are okay with it. And many doctors also fear appearing weak if they seek a professional help or any kind of an psychological support. So this adds on to the factor, also adds on that having a large amount of a stigma over it, we kind of work in a closed net circuit. They fear that whether the things are kept confidential. So all these things adds on to the factor on why doctors always, most of the time, hesitate to take a professional help. Is it only the mental health, or is there anything else also which contributes to our burnout or stress? Of course, it's an occupational hazard and also the physical health which it contributes to. they are mostly exposed not only to an emotional stress, but also to the physical and the occupational hazards. Like, we regularly get faced with infections. It could be violence against the doctors, then radiation hazards, it could be, or a sedentary lifestyle, prolonged standing, or these things. Over time, it contributes to the hypertension or cardiovascular disease or obesity or a chronic fatigue. So these are the stress is not only psychological, but also majorly it adds on to the physical disease as well. Is it that which is only, it doesn't stop over here? Also, we have something which is a major contributing factors also is a stringent laws which we go through. In modern medicine, what happens is doctor today, they work under constant medico-legal pressures. Like, they fear of having a complaint raised, even for a small period of waiting in the waiting area. If 15 minutes goes off, one patient takes more time, then that also is raised as a complaint in a corporate hospitals. And also a lot of time consumer court or a police case or a media sensitization or a violence from the attendants. So most of the time now the practice has become more of a defensive medicine. It is not because they lack confidence, but they are afraid about all this things which is going on. When you're left into a lot of constant hypervigilant itself, it becomes more of a psychologically, it becomes more exhausting rather than showing your own professional skills. If we see, when I was mentioning, does all specialties undergo this amount of burnout or this amount of a stress, where the life expectancy is what we are seeing? There are certain specialties where we see a lot of burnout rates. Like, for example, emergency medicine, most of the time it is 40%, anesthesia, surgeons, oncology, obstetricians, they all involved to a high stress exposure. The moment anyone is put into an high pressure working environment, their ability to functionality or taking decisions drastically decreases, which eventually leads to a mental exhaustion, which leads to some amount of psychopathology. It could lead to a depression or a suicidal rates are much more rare, which I will be talking about in a coming up slides. Even kind of most resilient persons breaks down without any adequate recovery. So this is what happens when you're constantly exposed to the stress or burnout levels. Now, when I'm talking about the stress or a burnout or a depression, is it the same? Anyone who is exposed to stress, can we say they are kind of having a depression? Not at all. First, when we talk about stress, is an kind of an threat which which is exposed. That is a fight or flight responses which we are kind of exposed to. When the person is exposed to stress, it is perceived, body is perceived as a perceived threat, where it could be taken as a positive stress, where your performance can increase. When this becomes much more evident, or it goes to a chronic state, which stress increases to alertness and a performance. Now, what happens here is, which they get into the phase of depletion phase, where they start experiencing exhaustion, ineffectivity in the work. There is no recovery time at all. There is no reward for whatever the work done. All these things contribute eventually to what we call as a functional difficulties. That is where they get into the kind of an overwhelming inability to cope up with. There is a systematic inflammation which happens, and studies have shown that depression is not just about feeling sad. It is about the neurobiological changes which happens in our brain, where there is a change in the working pattern of us. Now, what happens when there is a stress? Does our brain reacts in different way, or is there any neurological basis to it? Whenever we are exposed to a chronic stress, there is a changes in the brain functionality, as I was mentioning earlier. That is, areas which are responsible. Now, when your brain is constantly exposed to stress, now there is some changes which happens in a hippocampus and prefrontal cortex. Now, what happens, this area is, which is responsible for the memory, concentration, and judgment. Now, also the amygdala also, which is in kind of an emotional, which carries on with our emotional abilities. There is hyperreactive state which happens. Now, which increases your anxiety and emotional reactivity. Now, this explains why when you are when you're exposed to a chronic stress, in fact, your concentration ability decreases. There is a lot of forgetfulness which happens. There is a lot of irritability. There is a sleep issues. There is also an emotional exhaustion. Now, when most of the time, it need not have to be that person comes to our OPD, or when they would want to take a professional help, they would come and say, no, I'm having depression, or I'm having a low mood. This is all a textbook description which we usually see. But most of the time, when the client comes to us, it is all they say is, I'm forgetting small things in my day-to-day life. I'm unable to concentrate at my work, or my sleep is disturbed most commonly, or they would have increased their substance use. So these are the things which they usually come across. The consequences, now what happens when there is a chronic exposure to these kind of a stress, then there is it becomes a systemic involvement. Like, we know this also increases, and there are contributing factors for having an cardiovascular diseases, or having a metabolic syndrome, or their immunity shuts down, or there is a kind of a disturbed sleep, or there is a cognitive ability which is kind of impacted. So we need to understand that when the person has a burnout, it is not just simply an emotional issues. It affects emotionally, psychologically, and also the physical factors. It also contributes to the other physical illness also. Now, what happens when there is a lot of person, or doctors, or anyone who is exposed to chronic stress? They will start experiencing what is kind of a depressive disorder. We all know that when we were talking about initially why the doctor's life expectancy decreases, it could be, and most of the time contributing factors are lot of stress, depression, and the other cardiovascular diseases. They're more prone for MI. All these things are there, but it is very, very alarming and very disturbing that among the health consequences, also the suicide among the professionals is much, much more beyond. Why? Because significantly, you can notice here almost about 2.5 times higher suicidal risk than comparatively to the general population. It could be one pre-existing issues with the depression, or compared to the general population is much more higher. This is one of the studies which was done where almost about the tragic toll about, see, you work hard so much to get into an MBBS or a post-graduation, but simply after getting into post-graduation, they just start giving up. They say, no, I cannot work for longer hours. No, this is not for me. And also the most tragic event is they end up having an kind of a suicidal ideation or a suicidal death, where almost about, we have to see, this is almost about 1,166 dropouts were noticed in last 5 years who have joined postgraduates. So these are very, very important for us to know that when there is a kind of all these things, there are many factors among the doctors which contributes very silently, where they fear judgment, there is a professional consequences, all these things are there. The highest amount of the suicidal risk was noticed in anesthesia, general medicine, psychiatry, and look at the age here, almost about their age of about 21 to 30 years of age, very, very young, a productive age. So these are where we are losing on to it. When we say the risk factors, are there warning signs to it? Can we recognize all these things? Definitely yes. But we need to recognize it to resolve this, which includes having a withdrawal behavior or kind of hopelessness when the person has an emotional shutdown, exhaustion, or there is an increased amount of substance use. All these things, social isolation, these are all the factors which we need to recognize as a warning signs. Now, what are the risk factors? We all been talking about having an occupational hazard or having a stigma towards the mental health or having a professional stress. All these things, and also not only to the professional front, also at the personal front. So whenever these things contribute, so there is a high chances that the person is most kind of exposed to the suicidal thoughts. Though from outside, person might say, I'm okay, I'm all right, or I'm happy with whatever things are. But actually, internally, there could be a lot of several factors where the person could be suffering from. Now, very high functioning medical professional where they would, they have chosen what they would want to. But what happens to the brain when there is something which suicidal thoughts goes into it? There is one phase one, there is a vulnerability where there is what we call as a diastasis and that stress and trauma. One is there is a person who are constantly exposed to an hypothalamic pituitary adrenal axis of an stress. There is a gene expression or a gene functionality there is a changes which undergoes, contributing to an psychiatric disorders where the capability of the suicide increases in them. That is that they become a tunnel vision where adds on to there is a perceived burdenness to it, where it is not that person wants to die. It is just that they would want to get away with the pain. There is a psychological pain which they would want to kind of numb. They would want to shut it on. So that is why the person experiences that. When we have talked about all these things, about the suicide, about what is happening with our medical professional, when why mental health has been neglected or it contributes to the physical or psychological issues, now how do we cope up with it? One is we can either take an account of personally as well as when we are living in a setup of an organizational front. Having an healthy lifestyle is very, very important. At least a minimum of 30 minutes of having an exercise, balancing diet, or 6 hours of sleep is so very important. At least having a power nap in between the work also fixes up the things. Time management, prioritizing your task, scheduling your specific time for work or rest is more important. Because one of the doctor client who I was talking to, he had come for a help. So I saw him telling that from past 15 to 20 years, he has not attended any of the family functions. There is no socialization at all. So this is a very alarming thing. Are we work devoted or a workaholic? There are two different things here. Social support, family, friends, colleagues are so very important. Everyone works for money. Money is so important for our comfort, and this is what we work for. But having a financial smartness is very important. Passive income is very, very important for us to have a comfortable life. Because what you work as a 20 and 30, the same thing you cannot go on at your 50s or 60s. Having self-awareness, recognize the signs of stress, recognizing the signs of burnout, and how do you implement that is very, very important. And when we come down to an organization or an institute-wise, workplace environment or a management demands or being a supportive staff or having a small unit of an employee assistance program where you have a small celebrations. Even it could be a small birthday celebrations, which can be, or having a counselor in your own system. So where you can have a confidential talks over there, or a pro health policies, and having a training over the awareness program, where how do you build a resilience? How do you reduce the stigma over it? So these gives a positive aspects to it. So to conclude, for a take-home message, I would want to say that doctors are facing increasing physical, emotional, and as well as a psychological burden. We know burnout and suicide are among doctors are very, very real. It is very, very serious issues. And it is one of the things which is preventable. And seeking help is never should be thought as a weakness. Whereas self-awareness is not kind of it need not have to be taught as selfishness. This is what we work for, and this we deserve it. So a kind of an healthy, to create a healthy or a healthcare system, it cannot exist without a healthy doctors. So with this, I would want to conclude my presentation. Thank you all for patient listening. And now the house is open for the discussion. Any doubts, anything we can...
With the kind permission of our President, Dr. Veerabhadraya, sir. Sir, can I ask a question, sir?
Sure, sir.
Dr. Shanmuganandan here. Madam, first of all, I should congratulate you on your excellent presentation. You have been able to cover all the essential points that are required to identify what exactly problem with the medical profession and what are the issues that can occur and how to tackle it. I once again congratulate you on behalf of all the participants.
Thank you, sir.
One question
Thank you,
is,
sir. Yes.
Madam, it's just a surprise that came to me. Now,
Yes.
among psychiatrists who are supposed to be well trained to handle such situations, how good
Yeah.
are they when they themselves are being subjected to problems? And is there
Yes.
any statistical proof to say that these people are much better in handling situations as compared to the other doctors who are not trained in the field of psychiatry?
Yes. Sir, one is the first question of what you asked is among the burden or the life expectancy is decreased. As I was mentioning, anesthesia and psychiatry, all these things are the kind of a field. Now, what happens when you're speaking to mental health professional is it is very different comparatively to other branches. Why? Because you are dealing with an emotional stress most of the time. You are kind of sitting and listening to the pain, psychological issues of another person, which will impact you emotionally. What I have seen is most of the time, most oftenly, over 50 or over 60, most of the counselors or a psychologist or psychiatrist stop practicing over time because that amount of burden is not, they will not be able to take. And the Niemans have done the studies over time, even in abroad also, what they do is they will give a 2 months or a 3 months of at a stretch when you're working in an institute, you are given a paid holidays. You need not have, you have to completely de-stress. So this is one of the factors which is there. One. The second one is what you were mentioning, that is there any data to say they're better at handling this thing or see, every profession has its own pros and cons in the way they handle things. Like, when you come to psychiatry, it is not that it is some kind of an emergency you will inculcate into most of the time. But when you sit for 1 hour, see, a general physician can see a patient for about 5 minutes, do the diagnosis, give the prescription, and you can send. But imagine when you're sitting in front of a psychiatrist or a mental health professional or a counselor, you're sitting for almost a minimum of 20 minutes to almost in 1 hour of a therapy sessions. So it is not just about the disorder. You know the person in and out. One thing, as a professional, to some extent, emotionally, they will be able to handle things. But we are all human beings. we all come with all the traumas, we all come with all the issues. And I would not say anyone for that matter would be having a leverage better aspects to handling those emotions. No, it doesn't give us any edge on whether you are a better person or not.
Okay, okay, okay. Right. Thank you, madam. Thank you. Thank you.
Yeah, thank you, sir. Thank you.
It was really a nice presentation, madam.
Thank you.
And
Thank
the
you.
main thing, what you told, we have to differentiate between workaholic and work devoted. I
Yes.
think that everybody should know that when we should devote towards our work, and when to draw a line we become a workaholic. I think everyone should at least give some importance towards that. And the age is also very important, that you stressed, because
Yeah.
we can't work the whole day and night at 50s and 60s, so, like how we work in 30s and 40s. So that also,
Yeah.
like, we should know when to draw a line, because
Yeah.
for doctors there is no limit for practice, because every
Yes.
time we see the last patient, one more patient we'll see that will drive us to work late nights, and even the whole night we'll be getting calls. So I think we have to draw a line, and we have to fix our timings, and we have to fix our patients. Appointments has to be limited. I think then only all that stress will come down. This for practitioners, and I think for students and others, there should be some three lakh people who are wanting to become doctors every year throughout the country, and there is a lot of stress on them. So people who get a seat, there is a different problem. Who doesn't get a seat, there is a lot of problems. So all those things needs to be addressed. Especially in our country, psychiatry takes a back seat. It is not like in Europe and US, like where psychiatrists, there are a lot of psychiatrists, and people, they feel free to go to a psychiatrist and speak. But in our country, it is a taboo, because going to a psychiatrist, like, it is like their brain is not proper, it is not working properly, or they have that feeling that they are not normal. So that
Yeah.
taboo should go off. And I think everybody should have some counseling sessions, whether be a
Yes.
student during MBBS or a postgraduate or while practicing. I think that should be the case, madam.
Yeah. Yeah. True, sir. Exactly.
Madam, Dr. Pavana, madam, you have given very beautiful presentation.
Yes, sir. Thank you, sir.
Actually, one of the biggest problem with the doctors, madam, with the 25 years of clinical practice, we have to learn how to delegate the work and distribute the work. That is where we fail. We take the stress. We have to have the teamwork. With the teamwork, most of the stress can be, divided. Work can be divided, and workload, stress, all those things will come down, madam. Because as you, healthier doctor can serve patient better. So with my experience, we should, as Dr. Pawan was telling, we should know when we should stop our seeing the patient. Like that, if we have the teamwork, definitely stress will come down, and work efficiency of the work, giving good care to the patient is possible, and stress also will come down.
Yes. Sir, I'll just add one point here. See, because we are in medical schools, we are taught to be a good clinician, but we should also be taught to be a good administrator. So to carry on that leadership qualities, so how do you manage people, communication skills? All these things are very important when you come back. See, because when we start practicing, we are not only being good at clinical work is not good enough. You need to have a good documentation. You need to know how do you talk to the patient, how do you, kind of those kind of skills are very, very important. But we just like a machine, we train them clinically and we leave them outside to the world where they don't know how to handle. And that is where the violence against the doctors are more, they get into the medical legal issues. So all these things are much more, you become very defensive over time.
Hello, madam. Pavana Madam,
Yes.
Dr. Vinaya,
Yes.
as you said rightly, in the new syllabus that is as instructed by MCI, that is National Medical Council, we have introduced in the institute, as I'm attached to an institution, I can understand, there is something called as
Yeah.
ADCOM. ADCOM, you also must be aware of it,
Yes, yes,
wherein
yes,
they
yes,
do
exactly.
take special classes, wherein they teach the way of communication, documentation,
Yes.
attitude, ethics, all those things are also, I mean, people are, and the authorities and commissions are all trying to make an effort in that direction also. I thought I'll
Yes,
just
yes,
mention
yes,
about it.
yes,
It was
yes.
a very nice session, madam.
Thank you.
Thank you so
madam.
much. Thank you.
Sir, Dr. Harish Delanthabittu, would you like to add anything, sir?
I congratulate her for a wonderful talk.
Thank you, sir.
Our President, Dr. Veerabhadraya, sir, would you like to add
It
anything?
was wonderful talk. We enjoyed it.
Thank you, sir.
And
Thank you so much. Yeah.
home-taking message was a lot more are there. So thank you very much, madam, for a nice
Thank you,
presentation.
sir. Thank you. Thank you.
I think there is a message to IMA. We should increase more of sports and social activities, social gatherings, and picnics. Apart from concentrating only on academic thing.
More parties, antana.
Because as Dr. Pawan was telling, if you become IMA member, your lifespan will increase.
Trekking also, sir. Trekking.
Yes, sir. I think becoming IMA member usually reduces stress while practicing. That is for true.
True, true.
In IMA Yelahanka, sir, we have developed a culture where very often, around once in 3 months or 6 months, we go for trekking.
Oh, nice.
Those activities will relax and good understanding between the doctors, and when they are in difficulty, other person will come and help. And this culture we can be can be adopted by rest of the other branches also. We should frequently, as Dr. Rajendra Prasad said, we should have more social activities in IMA.
Sir, if there are no more questions, I will go ahead with the vote of thanks.
Yes, sir.
Yes, sir. I thank our President, Dr. Veerabhadraya, who inaugurated this
Thank you, sir.
meeting. And I thank our Secretary, Dr. Suri Raju. And I thank our guest speaker, Dr. Pavana. I thank our President-elect, Dr. Harish Delanthabittu. And my thanks to our senior office bearer, Dr. V.C. Shanmugananda. And our own chairman of the Public Health Forum, Dr. Pawan Kumar. And our senior member, Dr. Veena Bhatt is present. And Dr. Shivkumar Uttare was also present for some time. At present, he is not there. Thank you
Yes,
very
sir.
much. Thanks, Sean.
Thank you.
Thank you. Thank you, sir.
Once again, thank you for a wonderful lecture, sir. Thank you. Thank you very much.
Thank you, sir. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.